am Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with the lifelong medication. Here we learn of the approach for a patient, 15 years old male, teenager, suffering from vitiligo for the last 1.5 years on treatment. That is, he is taking POA therapy, that is a common treatment given. And lesions mainly in the armpit and the chest. Luckily, he doesn't have anything on the face or the hands. That is also very common. And also he is suffering from allergy sneezing. Allergic sneezing is very discomforting for him. And also recurrent abscess on the buttocks, mainly on the buttocks. So he finds it difficult to sit, especially as a school-going child. So he finds it very difficult. And also currently his another worry is for the last 1.5 years he is on treatment, but his vitiligo, that is hypopigmentation, is not going, but only slight reduction in the fading is there, but not going. And also the whole body, his skin is getting darkened. So that is a side effect of the medication and the sun exposure. He is getting darker, but only the disease is not going, and few more patches are coming also. Here I will try to explain how the surgery could be avoided, how long it took for multiple medications to be reduced and stopped, how long it took to get relief from symptoms, and progress evaluation based on corresponding improvements in the periodic tests. Next, when we come to the details of the patient, it's a 15-year-old boy, male. His height is 172 centimeters and weight is 54.7 kg. And his fat percentage only 13.7, that is okay, ideal. It's in the limit only. And he is suffering from vitiligo, that is hypopigmentation of the skin for the last 1.5 years. And main lesions is in the armpit and the chest. It is actually more of a private areas actually. And he is on POA therapy. POA therapy means it's a name is derived from the POA. It's a psoralen. Psoralen is the medicine. One psoralen tablet or ointment is applied and get ultraviolet air rays exposure. So ultraviolet air importance is is the most strongest rays. But the peak time in the sun is actually 11 to 2 or 3 p.m. So that time is the peak time with the ultraviolet air rays. Actually, that is the damaging light also. So that is ultraviolet rays exposure is the reason for the skin cancer also. And actually, in as a part of the treatment, we are exposing this harmful rays with making it to the stronger exposure. This exposure sensitivity is increased. This ultraviolet rays, air rays, and sensitivity is increased by taking the psoralen also. So typically, it is not an ideal treatment because you are exposing the skin to some sort of risk to avoid this hypopigmentation and the aesthetic aspect of this problem. Actually, the disease is not, it's an autoimmune disease actually. Basically, the vitiligo is an autoimmune disease where your immune system is attacking your own melanocyte, which is making the pigment for the skin. But the treatment is not correcting this psoralen or POA therapy is not of benefit in correcting the disease process actually, only the symptomatic relief. So for that actually we are exposing this ultraviolet UV rays, which is really harmful, and even it is by taking medication you are making it more sensitive. Then only you will get the result. This pigmentation problem, because you are stimulating the cells to make more melanin. Melanin is actually the protector of the, it is a protective effect. So we can see that Africans are the one who's residing near the tropical area or the central part of the earth where the maximum getting the sunlight is exposure is there, are darker skin. That is actually a protective mechanism, and this protective mechanism is attacked by the immune system itself, and for that it is logically the treatment is not actually the ideal treatment, or only that cosmetic result is there actually for that. So, and he is suffering from respiratory allergy also. And allergy and autoimmune disease goes together usually. Usually when we take any autoimmune disease like vitiligo, psoriasis, eczema can be there from the childhood itself, or this Hashimoto's thyroiditis, etc. There can be a period of other infections, history of infections and recurrent allergic episodes. So that is also actually it is a derailment in the immune system. So any autoimmune disease or all the allergic disorder, in fact any disease, there is a problem with the immune system, then only you get a disease. So this patient also is having allergy also, sneezing is the major, and also he is getting recurrent abscess, especially on the buttocks. So it can be another form of autoimmune disease is there, hidradenitis suppurativa. I don't know, maybe it is another milder form of that also. And the disease category when we come to autoimmune disease and allergy. So when we look into the details of the patient, the symptoms actually sneezing, gastric issues also there, and darkening of the skin, and hypo and general darkening, and also the persistent hypopigmentation, and small new areas are coming up also. And about the treatment, actually he is taking Troid 25 milligram, that is trioxazole, that is tablet. It is a soralin group of medicine. Soralin actually is derived from a plant derivative, but it is now, there are many other modified forms and all is there. So one of the forms. And after that he has to, this ultraviolet A rays, that is O therapy. When we come into the blood report, his vitamin D level is low. Actually, we may wonder why after all this O therapy, there is exposure to sun itself, why his vitamin D level is low. Actually, the vitamin D's production, it is not the UVA, it is the UVB rays is the more beneficial. So maybe because of that, I'm giving a logical explanation. I think like that because you don't get any explanation in the net or anything for that usually. So I think that it is because the UA is for the other thing, and UB rays is the beneficial for. So for the morning sun or the evening sun, that is what we advise for the generally people to get vitamin D, to produce the body produce vitamin D, and also for the psychiatric patients to get. There are so many things are made in our skin itself when the sun is, when you get the sun exposure. So usually we avoid this midday sun, and the morning and evening sun is best for the health actually. But for the therapy you use the midday sun actually. So, and other things, CSR was slightly high, it is not that significant, and also potassium level was high. That may be because of the cellular destruction with this soralin and PO therapy. The cells are destroyed and sensitized, and some sort of destruction is also taking place. Maybe because of that the potassium level is high. And his tin level, that is a toxic element actually, it's a heavy metal group. So his tin element level is very high, that is 14. It should be less than 2 only, but it is more than 14. Maybe because of our modern day food packing system and all. We know that we are using tin, this aluminium foils and all. I don't know, there are tinned food and also the aluminium foil from which this tin is coming. It's a many patients with, especially with autoimmune disease. This result is tin level is very high in our part of the country. That is, basically most of these patients from this patient is specifically, he is born and brought up in Kochi itself. So it's Kerala. So many patients from the Kerala is having a tin level is high in those sick patients actually. When we come into his body parameters. His weight is in the normal range only. He's 15 years and the height is 172. For a boy like him, is 54.7 is in the normal range, that is in the 18.5 BMI. So low normal for the boys, this younger children, it is 16 to 18 is the ideal actually, 18.5 or maximum if it is very muscular up to 21. So he's 18.5 and 54 kg, that is okay. And his BP and abdominal circumference is okay, slightly high but it is okay. And body age also, it's children we cannot assess the body age of below 18 years. And body fat percentage is only 13%. So around 7 to 15 is the ideal actually for this at this age. So when we come into the treatment part or the lifestyle modulation, for this person, what is the mode of treatment actually, or the lifestyle modulation? For him, he is actually allergic to many food items actually. So we had to, we check the body's reaction to food also, food and the inhalants, and that is we call it allergy test and food intolerance test and all. In that actually his immune system is reacting to many common food like capsicum, cocoa, or we are all taking, children are taking chocolates and all, the cocoa powder and all. So he's allergic to that. Almond, he's allergic. Tomatoes, curd, all the milk and milk products he's allergic. And dal chana, it is a favorite dish in Kerala and all over India. Dal chana is very favorite dish. And inhalants like house dust mite allergy, dog dander allergy, house dust, paper dust and all. Remember he's having sneezing also. And other foods like egg white, he's very highly sensitive to egg white. And milk, all sort of milk and milk product, casein. And the pea, that is another pulse group we are very commonly used here as in the form of paripu vada and all. It is common in Kerala dish. And orange, wheat preparation. And potato. Yeast is used in many preparations like bread and making bread. And even in Kerala, there's our favorite dish, appam, which is also yeast is added. And beans, and many things, corn, pistachio, so many other things are also he's allergic. And I'm not going into the details because it's all individualized. Okay, I just want to make clear that all these food items which is actually reacting body to be avoided in such patients actually. So then other food, he doesn't need a local because he's a child, he's playing. Only thing is keep his body, don't gain fat in the body. He can gain muscle mass but don't gain fat. That is the thing. We want to reduce the fat percentage to around 10 or below, 7 to 10 actually in the initial, and then he can build up with a good fat. That is, good fat means for most of these patients with the disease, the fat percentage, he doesn't have much increase in fat, but the whatever fat in that will be having a high omega-6. That omega-6 is inflammatory. Omega-6 is activating this immune system. It's defensive. So the immune system is so defensive and it is derailed and it is acting against our own the patient's own cells. That is the problem in this all autoimmune disease. So what we are trying is to reduce the fat content in the body and especially the omega-6 content, and try to increase the fat omega-3, that is anti-inflammatory, and to bring a balance in the omega-3, 6 balance into ideally human body. The omega-3 and omega-6 should be in the 1:1 ratio. But in our food, the omega-6 is very high because of the high intake of nuts and oil seeds and vegetable oil in our food currently. But omega-3 is very low, that is there only in leafy vegetable. No one is taking much of leafy vegetable. And also some seeds like this mustard or the fenugreek. So that all we are taking very low, or the fish like salmon or sardine. In our part of the country, we don't get much of salmon. If it is salmon, it is imported only, maybe tinned for a long time. So tin is also already too much of tin is there. So we get the sardine very plenty here. Sardine is a good source, but it cannot compete with the high dose of this nuts and oil seeds and the vegetable oils for using for fries and we are using. That is the problem actually. And also the children, the basic problem is so much of toxins coming into body also in the form of color, preservatives, and food additives, tastemakers and all. So that is also adding the problem, adding the strain of the immune system. And along with that, there may be so many nutritional deficiency. In this boy itself, he is having deficient in vitamin D. May not be. We are not looking into all the vitamins because anyway we are providing all the vitamins. So we are not going into checking all the things. Vitamin D, usually, no, most of the patient, if you are checking for the 100%, 99 will be deficient unless they are taking food dietary supplements. So that is the common now. So that is why we are checking it, and we need extra dose has to be given for that. Otherwise, all the vitamins we are ensuring in the diets itself. So we are not looking into all the aspects. Or in terms of vitamins, we are not checking all the vitamins because it adds the cost of treatment also. And when we had to recheck, and we only for the very few vitamins we like B12 or folate and all, we regularly check, and vitamin D. The others, if one of it is deficient, we take it as other may be deficient and give supplements accordingly. So in this clinically supported lifestyle correction, we are ensuring all the nutrients and also making sure that this toxin entering in the body is minimized, so that giving a rest for the immune system. So he's advised to take anything which is his body is responding, or to intolerant or the allergic food he should not take. Otherwise, he can take, because he's saying he can take other pulses, leafy vegetable. We promote taking more leafy vegetables and pulses, or if you are non-vegetarian, take fish or meat or whatever you are interested. If you can like the sardine, we always promote to take more sardine also. So for about the sun exposure, he was taking this POA therapy. We want, because he's getting darkened, so we wanted to avoid the soralin or the trioxazolin medication. So we gradually reduced, and within 8th day itself, actually he is symptomatically free. So sneezing was gone by almost 70% reduction. By 15th day it was 80% is gone, and by 30 days there's no symptoms of sneezing, and the gastric issue is gone. And the darkening of skin was the other problem, and the hypo and hyperpigmentation. So his hyperpigmentation was reducing in the size and the intensity also. It was evident by the 15th day itself actually. So by 8th day itself he started reducing the trioxazolin level, and by 30th day the medicine was stopped. And instead what we are giving is a special oil which is of omega-3, 6, 9 and some vitamins also inside that. It is applied on the skin and get the morning and evening sun, not the UVA. Actually we are promoting the patients to take morning and evening UVB and the visible spectrum of light on the skin. So with that, actually by 60 days, every day it was actually fading it. That appearance, the skin was getting normalized. And by 60 days almost, there is not, you cannot differentiate with the older hyperpigmentation patches, and his hyperpigmentation which is happening all over the body, it was also getting corrected. By 90 days, he was able to regain his old wheat complexion. That is actually, we Indians like the wheat complexion. Everyone is likened on the fairer skin, this lighter skin actually, that wheat is not too white also. But that is the preferred complexion among everyone. So he's a fair, this wheat complexion was there, he's able to regain that, and the hyperpigmented patches, that is vitiligo areas, were cleared, and make it not distinct, we cannot distinct the old areas also. And along with that, he is able to come out of other allergic symptoms also. Even the vitamin D level is corrected by 30 days, it has come up to normal, 64. And some ESR, that is inflammatory marker, was high, that is corrected. Potassium level was high, that is in the 8th day itself it got corrected. And the tin level was high, that by 90th day tin also became negative. So we are trying to avoid the toxins going in, and to try to remove the toxins which is accumulated in the body. And next, what was the changes in his body actually? His body actually, there was not much deviation, 54.7 kg. And actually by 90 days, his slight reduction has come, that is 53.4. But in the fat percentage, the change was marked. He was initially 13.13, that is okay in the normal range, but we wanted to avoid to burn out his stored fat to avoid this inflammatory fat. So his fat percentage came down to 7.7, that is 7 is the lower limit. So, and also his abdominal circumference, that abdominal fat was there, that was 76 he has come down to 72. And BMI, he was 18.5 and it came down to 18.1 by 90 days. And what we are expecting to do is to bring up his weight to around 60 kg by 180 days. See, to keep he's only 15 years, keep the BMI in around 18 itself. And abdominal circumference to 72. And body age till keep it like that. We cannot check the body age by at this age. Only after 18 it will read it. Otherwise it will show only. If it is below, it should our machine will show only below 18. So and keep his fat percentage between 7 and 14. So it will around 100 also. It is if when the hyperpigmentation is gone, he can keep it around 100. This thing, only thing he has advised what how he has to maintain himself. That is very important. So he should keep his body composition ideal, and especially for an youngster like this, he should keep the BMI below 21. And now he is keeping it low normal 18, but he can increase his BMI and increase naturally. It will slightly increase the BMI, but the fat percentage should be kept below 15%. And also he should not take the allergic food which are and also he should avoid the color preservatives, tastemakers, and the toxins he should avoid. And if he is having, you should also observe that any change is recurrence is coming, because lifestyle there will be always can be changes. The children there will be always the tempting things like chocolates, sweets, and this juice and such things will be there. So there can be, the children can go wrong, and go wrong means they can deviate from the ideal lifestyle. For the children especially, the parents' involvement also is very, very important. If such a minors, when you are joining for the lifestyle correction, we insist that one of the parent also has to join. Otherwise, if they don't know how to manage, if they are eating all the junk food and asking the child to take only tasty, because he is also used to for this all the junk food. So avoiding junk food only for the asking him to or her to avoid all these things and all the other family members taking, it won't be possible. So ideally one of the family, preferably if the two is having problem, if anyone is having problem, they should also join the program. This child's actually both the parents, father is diabetic with insulin and mother is having arthritis and so many problems. Actually mother was joined first for the program, and then only they thought of how come whether it will be beneficial for him. So initially mother is already a patient. He doesn't have any problem. That family is changed, and his father also joined, because he was not in a position to join because of his job and all, because a certain commitment has to be there when you are doing the clinically supported lifestyle correction. And later father also joined. So the whole family is doing a healthy life actually. So that is needed. Only if the children are having especially autoimmune disease, the parents' involvement, and even if they are sickness, they are joining the program is even if they don't have any major health issue, one of the parents has to join for the, ideally the mother has to join for the program. Then only we will get a very good result. This we are totally happy. The parents are happy. The child is happy. Because he's come out of all his health problem. For the adolescents and this sort of children, another advantage is actually he's getting the correct nutrition and correct exercise pattern and everything in the prime age, that is the development age itself. So it will help him to improve the body in a systematic development of the body and also the brain function. Because he's getting high, the food itself is very high in omega-3 and all. Omega-3 is very important for the brain, and that is the time that is the cutting and trimming and all the things happening in the neurons. So the academic performance and all will be, the cognitive improvement, memory improvement, academic performance also all will be, can be optimized. Actually, this is the ideal, that all the children should be, the health should be optimized at this, especially at the teenage time, after 12 years. That is the most, children also will be most receptive and they will get the maximum benefit. For clinically supported lifestyle correction, is maximum benefit will be for the children actually, because they get the benefit throughout their life. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of the surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical, and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat, and stool. It will reach the groundwater, rivers, drinking water, plants, animals, and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases, and come out of medications. To protect your children, grandchildren, and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.